This is Health Tracks, and I'm Peter Graber. NC Spin held a healthcare forum last week that attracted almost 200 business, healthcare, and healthcare policy leaders from across North Carolina. Hosted by NC Spin's Tom Campbell, the event featured a keynote address by Dr. Victor Zhao of Duke University Health Systems, and 3 key panel discussions that focused on health policy, healthcare innovations, and the best practices that are happening across our state. Here's a short recap of the conference and the perspectives of Chapter President Dr. Brian Forrest.
Spin's Tom Campbell keynote of the conference that was co-sponsored by the North Carolina Academy and featured several topics, including a healthcare panel discussion on healthcare innovations. NCAFP past president and CEO of Community Care of North Carolina, Dr. Alan Dobson, had this to share about CCNC's design, framework, and its impact on North Carolina.
A lot of what Community Care has done is a framework around collaboration, empowering communities to come together to come up with a better system. And then taking that great innovation that's coming out of all our areas and figuring out a way how to scale it up across the state. And
each of the 3 panel discussions focused on 3 different areas, but several themes emerged. Dr. Brian Forrest, president of the NCAFP, had this to share about them.
Peter, it looks like the theme that we're hearing this morning is certainly all of our panel members so far have emphasized that what patients and what the healthcare community is looking for is decreased cost, increased quality, and also maintaining access for choice of physicians.
Finally, NC Spin also released the results of a public opinion policy poll that showed over 80% of North Carolina citizens receive their primary care through a primary care physician where they have a personal relationship. To read more on the survey, see ncspin.com. For NC Health Tracks, I'm Peter Graber.